Hello and Assalamualaikum. I'm Shahrul Nizam Berusli, Deputy Student Year 3. Today I will talk about chronic kidney disease or other as is CKD. CKD can be defined as GFR, that is glomerular filter rate, is less than 60 millimeter per minute per 1.73 meter square for more than 3 months. This based on MNT for CKD. According to the clinical practice guidelines for management of CKD, this disease has emerged as a global public health. It may lead to the end-stage renal disease, and this will cause mortality if without prevention or treatment. According to the one journal that has been published from PubMed, there are 5 stages before being categorized as end-stage renal disease. The decline in renal function is usually progressive. There are several risk factors that can be related with CKD. For example, the first one is patient with diabetes mellitus and or hypertension should be screened at least yearly for chronic kidney disease. The second one is obesity, cardiovascular disease, metabolic syndrome. For example, if patient take a drug, there is nephrotic drug or long-term use of proton pump inhibitor or analgesic, or family history of CKD or hereditary kidney disease. This can be referred from the CPG management of CKD. Okay, next is for the energy requirement. If the patient is below than 60 years old, patient can take about 35 kilocalorie per day. For patient with above 60 years old, patient can take 30 to 35 kilocalorie per day. We also must consider patient BMI. If the patient is underweight, we can use BMI at 20, or if patient is overweight, we can use BMI at 25. For the protein requirement, based on MNT 2005, for the stage 1 and stage 2, the patient can take 0.8 kilo per body weight. For the stage 3 and 4, the patient can take 0.6 kilo per body weight. If the patient is severely malnourished, a patient can take 0.75 gram. We also must consider that 50% of protein is come from the high biological value. We also need to consider patient BMI. For the nutrient recommendation for fat, the patient can take 30% less than 30% of the total energy intake. For the sodium, the patient can take 2.4 gram per day. This is equivalent to 1 teaspoon of salt. If the patient has presence of edema, the patient only can take about 1,500 milligram per day. For potassium, there is no restriction unless the patient has hyperkalemia. And the phosphate, there is no restriction unless the patient has hyperphosphatemia. Okay, thank you.